Thanks so much, Joel. Thanks to the CKM2 team for facilitating this, but most of all, thanks to Transform WASH for highlighting for us today how we can transform sanitation markets. Next slide. I'll give a brief overview of first the Global Water Strategy and Action Research Initiative that led to this work, and then we'll hear directly from the Transform WASH team on their 3 high-level major learnings over 5 years of implementation, and then we'll hear some reflections from LIXIL and USAID's partnership with them, the Partnership for Better Living, on how this aligns with their global learning. And then Jesse Shapiro from WASHPaLS #2 will reflect on the learnings and how they advance and align with the global evidence base that's been largely collated by WASHPaLS #2. And then we'll have a brief Q&A. So we encourage folks to put questions into the Q&A box as you think about it. As the presentation goes on, we will cover the questions at the end, but go ahead and start entering questions as the presenters go through. So now on the global water strategy, that's what is really the guiding document for USAID. It's a US government document outlining a vision for a water secure world. And on the next slide, we show basically our high-level ambitious targets that are specifically for USAID, targeting 22 million people with new or improved access to water and 22 million with sanitation. And importantly, we're targeting that at least half of that will reach people with new access. Now, we also capture how we intend to tackle essential system strengthening activities like mobilizing finance and improving institutional governance across 30 countries. So recognizing these ambitious targets, on the next slide, we have some of the operating principles that we need to cover in order to do this. One of the important ones we'll be discussing today is leveraging data, research, learning, and innovation. We acknowledge that there are evidence gaps that we need to cover in order to achieve our goal, and that's why we're having this webinar today, and that's why we launched the next slide, our Action Research Initiative, which will generate evidence for decision-making in WASH and WRM. Now, what is the Global Water Strategy Action Research Initiative? It's a multi-million-dollar investment in water security, sanitation, and hygiene research, and we're framing it as action research because really this is research that's aimed to be program and policy relevant, and that will benefit the effectiveness and impact of the sector investments, not only those made by USAID, but also partner governments and other funders and practitioners. So who's involved primarily? Well, everyone on this call is involved. Thanks for joining today. But certainly our implementing partners are the ones primarily implementing a lot of the learning. Much of this is coming from central research mechanisms. I imagine many people on this call have been on webinars for ProWash, Real Water, WASHPaLS #2, etc. But I think the real treat today is that we get to hear from a bilateral activity. So Transform WASH has been a really exciting project to be able to share with you today. I'm honored to be presenting with them. We were very excited that they reached out to us with interest in doing a webinar, and I think this jives really well with our Action Research Initiative, pairing up these 2 tracks and how central research mechanisms can also be leveraged and be informed by bilateral activities, which in USAID speak is an activity that's implemented directly by one of our country offices, one of our USAID missions. So that will be demonstrated from today's webinar. And without further ado, I'll hand it over to the Transform WASH Ethiopia team. Very excited to hear from them. Thanks so much.
Thank you, Ryan, and also USAID for giving us this opportunity to share our learning captured from our transformation activities in the last 8 years. So before going directly to the lesson learned, the three lesson learned, I'm trying to introduce what USAID Transformation Ethiopia is. USAID Transformation Ethiopia is funded by USAID, and it is a 5 year, no, it's an 8 year activity and implemented by PSI with its collaborative partners of SNV and RC. And the main approach that we are using is testing and developing the market-based models and in order to use for basic products, the sanitation product and service. We have four critical result areas in order to achieve the objective. So the four result areas are already derived from the market development ingredient with the slide show. So the first result areas are in line with strengthening the enabling environment. So as you well know, working with in the context of Ethiopia, it's very critical and very important to work with the government of Ethiopia in order to facilitate the market development work and also critically linking with the work that the private sectors engaging. So in this one, we are engaging with the government in terms of building their capacity and their support. And the other critical ingredient, which is important for market development, is the demand one. So the sustained demand is very critical, especially for low cost and quality wash product and service through user-centered kinds of marketing techniques. So our sustained demand, we are using two different approach. One is community level approach through the health extension worker. So the government structure, which goes to the community level, are very critical and important in terms of creating demand. The other one is, which is very critical, in the market approach, which is using the private sector, especially in order to activate demand for product sales. And the other important ingredient is the supply chain. So improving supply chain is very important and very critical, especially coming with different wash product choices, technologies, and the other critical thing is related with financing, which is more important for the supply chain. The last one, which is not directly ingredient for market, but very critical in order to achieve the first three ingredients by capturing evidence and also learning and even to scale. So in the last 8 years journey that we have through Transform Wash, we captured a lot learning. So that is important for us. So the last ingredient is quite important. So just at the early stage of Transform Wash, we made early decisions for in order to progress the market for sanitation. Some of the decisions were one is the phased approach. So market, I think it's very critical. So learning and capturing through the process. So we are using a phased approach. So we have started from one region, 9 waradas, at the very beginning in 2017, in the first year, and then moved to four regions and 4 regions with 20 warada. And in the third year, we are moving to around 9 region and 41 waradas. And in the fourth year, about 63 waradas. So these are the phased approach that we followed. And the other decision was business partners, at least two business partners per district or waradas. And the other early decision was direct sales of plastic products and also concrete slabs manufacturing and sales. So these decisions have come up with their own challenges, which I will try to mention. Some of the challenges that we have faced and the approach that we follow even to mitigate the challenges. The first one is poor do-it-yourself installation of SATO pan. So at the early stage, we are directly install we sell and the community directly install SATO. This has been led us to a problem in terms of quality and everything. So due to that case, the governments have pushed us even to stop in one of the region to work. So based on this learning, we can come up with an approach like developing and scale new business and service delivery model, different models that we are capturing. So I think it will be presented soon, the models and also the approach. The other challenge is high transaction costs related with concrete casters like logistic, and it is difficult even to move concrete slabs from place to place. So for that purpose, we come up with an approach to solve this problem, like diversifying products and service option. The other challenge is fragile market, especially for construction inputs. So these are a really critical challenge. In order to alleviate these problems, we can come up with a diverse product approach and also customer-centered approach. So based on the affordability and based on the needs and the demands of the household, like different approach, like skirting and other approaches that came out. The last and the least one is low sales interest from our sales agent or commission workers. As you know, market is market, so pure market. So the sales agent, the private, within the low private sector, have been engaged in order to promote and sell products. But because of the affordability and others, they are not as satisfied to work because of low price they are getting. So they were discouraging and low sales this happened. In order to solve this one, an approach is coming, which is a new business model or a business partners coming to the space, and which is called Mason installers, in order to serve both the sales as well as the installation, so they can get it their income both from the sales as well as from the installation service. So having said this, I would directly invite Dagel to take us through the 3 lessons learned and captured. Over, Dagel.
Thank you, Mikhail. Good morning, good afternoon. So my name is Dagum Damro. I've been working in USAID Transformation for the past 7 years, throughout the project and through various capacities related to market development. Currently, I'm working as technical director for Market for Sanitation program, which is a follow-up for USAID Transformation. So, basically, I'm going to present you 3 key lessons learned. The first one will be focused on business model and supply chain. The next one will be focused on demand activation, especially our sales management activities, and the third one will be focused on the capacity building. And in this, I'll try to outline the approach that we followed and the key lessons that we have. So in the business model approach, as Mikhail mentioned before, one of the challenges were, the usual businesses that were followed by, other market-based sanitation or sanitation marketing program where, usually one type of approach which relies on provision of concrete casters or direct sales of plastic products. But we try to adapt from innovation from the market, and we come up with different kind of models. This is not going to be limited, even going further with market for sanitation. I think having new business models and service delivery models is really essential to have a better reach. So the 4 business models that we transformed WASH adapted were, the first one was advanced product manufacturing and construction, which involved a well-established businesses providing construction services and providing concrete casters, bigger concrete casters like concrete slab, floors, and solution, full toilet solution for rural and urban households with no toilets and unimproved toilets. So this involves, like unestablished enterprises with its own, place. So this is a bigger like of engaged a bigger like a medium to small to medium type of businesses. The other business model introduced was a basic product manufacturing and installation, which involves like a quite a smaller scale type of businesses, and the product offering include smaller concrete casters, and also this one also engaged for instance going door to door and providing installation services for various kind of concrete slabs and toilets. So it's really more related to provision of improvement for the toilet floor. The other one is, like, which is a very simple model for that focus on upgrading of toilets, door-to-door simple upgrade model. It worked with independent masons, providing their own sales, like going door to door in provision of sales and installation services of Satopam plastic slabs with concrete plastering of floors for rural and urban household with unimproved traditional latrines or open pits. So this was, the most prominent models, which really reach a lot of communities, and it also provide solutions for most of the challenges that we're facing. For example, the duty of yourself, customers doing their own installation had a lot of challenges of related to quality, standards and something like that. So by providing a smaller capacity building for masons, on sales, on how to do installation, we're able to alleviate this. We are also able to increase, access, because we're able to ensure that products that are sold from retail outlets were properly installed at household level. And the other one is, like, and cost wise is also very smaller, because it's really a low hanging fruit, because it relies on a structure that's already built by households and customers, and they usually also contribute with labor or something like that. So it was the most profitable one for the business, for masons as an additional activity, and also it was prominent because people were really interested to take up these services because it's customer centered. The other one is the plastic products and sales support, but this business to business in product sales that relies on retail outlets was not limited to sanitation products, but it includes other products like hand washing, ministerial hygiene products. And usually, masons and sales agents have a strong relationship, with these retail outlets that were all over the place in areas that we were intervening. So these were the basic models that we worked on, and we adapted from the learnings that we have from the market. So, in relation to this business model, we had early adaptation for the business models. So one is, we diversified product offerings. So one of the learnings that we had, uh, I think the usual trend was, to come up with, one or two type of products and try to address, sanitation challenges. But we have found out, otherwise diversifying product is a better approach, because, like, customer have got we have different kind of customer segments. They have different paying abilities, their willingness to pay, and their ability to pay is different, and also their need is different. So I mean, the usual market for other products, like for the consumer food and fast moving market, tends to provide different product offerings. So we also go for that. So we have adapted more than 40 type of product and service options. Out of this, 30 product and service options were related to sanitation, and the remaining was related to hand washing and hygiene products. We also try to adapt successful local innovations, like products and services like sato skirting and sato retrofitting options, were usually adapted from innovations from masons. Like, we try to uptake what masons are doing in different areas, and we try to standardize these innovations and introduce them into other areas. So we usually adapt successful local innovation. We also supported local entrepreneurs in the design of innovation product. In the period of transformation, we held different kind of innovation competitions for local research institutes and local entrepreneurs to come up with their own design options. We conducted competition for hand washing products, sanitation products, and hygiene products, and these were also introduced into the market. The other one is, we have also supported local manufacturing of products locally. For example, we've been trying to locally manufacture sato products, which was not really successful during the period of the transformation, but we were successful to produce, plastic slabs, which also had a huge reach and a huge, demand from customers. So this is what local manufacturing was also one of our approach that we followed, in relation to our business model. So, I mean, through this process over the period of usually like 5 to 7 years, more than 1 million people gain access to basic sanitation from, direct, market approach without any subsidy or without any support. This was a purely market, depending on market sales. Over those periods, we were able to have business partners that were established by USAID Transform WASH. We were able to sold more than 220,000 sanitation products, and also they were able to sell more than 38,000 other products, including hand washing stations and water filters. When we see the reach, as I mentioned earlier, we were working across 63 waradas, the maximum reach was 63 districts. So across these 63 districts, we were able to at least, increase access to sanitation services in average from 10 to 20%. The maximum was, I know, a warada that was able to increase access to sanitation by 35% during USAID Transform WASH, intervention. And there was also improvement beyond intervention area districts. The government has adapted our approach. Different development partners adapted our approach. We've supported, like the reach to be, more than 63 waradas. The training has reached more than 450 waradas, and the approach has been adapted by others. I mean, as you can see on the graph on the left, this is based on a study that was conducted by USAID Transform WASH on 3 selected districts. As you can see here, there is a huge leap in access to sanitation from 2020 to 2023. Almost, it's close to 11% leap across these 3 waradas. That there was this leap. So we were able to improve that market really could result in increase to access to sanitation. When we come to our key business model learning, one is, beside concrete products, plastic products are an attractive alternative because of their affordability, ease of installation, ease of transportation, ease of production, and, like products like especially Satupan has got also their own, it's really a very improved product because it has an automated closure. It really improves, the toilet experience of customers in households. And also we found out, because, in countries like Ethiopia, because of the huge effort, that was done, in implementation of CLTS approach. Most of the people, most of the household have basic sanitation, some form of basic sanitation. So upgrade option in introducing a low cost and simple improvement for household sanitation, we have found out to be really successful. So it also improves the sanitation experience, the facilities as they have, and it's also affordable and simple, and it also reach customers as their own doorstep. The other one is, rather than, like working with novice, unemployed users, which was usually the trend, especially in Ethiopia, focusing on experienced businesses would really result in viability of, the sanitation business even beyond the project period. I mean, across our implementation, across the 7 years of implementation, we have almost enrolled close to 500 businesses, and the business viability is close to 80%. Almost 80% of the businesses are still operating. This is because they are experienced businesses that have alternative portfolios, other portfolios too, and we really tend to focus on experienced businesses. I think that is the learnings that could be taken. The other one is door-to-door promotion and installation services. Not only the promotion, but also the service has to reach to the customer doorsteps. So this really reduces the customer burden, the customer journey. I mean, you can say like customers need to go to different locations 5 to 10 locations, they need to travel to a lot of places if this has been left for the customer. But now it's we try with the models that we had and the product and service type that we have brings the product and services to the customer's doorsteps, so they get it at their doorstep. So this relieves them from a lot of burden and increased the adaptation. So these are the key lessons that could be uptake from what we've done across business model and supply chain. Going to the next lesson is the lesson learned in demand activation in sales. So in demand activation and sales, we actually utilized an approach that is called DQ, sales and sales management approach. DQ actually stands for a decision intelligence. I mean, people are really usually familiar with EQ or IQ. DQ is the same, but it relates to decision making. So this is actually an approach that is developed by our partner within Enroy's partnership, which is a sales and sales management consultancy based in the US. And they usually provide this kind of consultancy services to for companies that range from Fortune 500 companies to business partners, like partners like us, development partners. And DQ is a process that walks the customers through a problem decision making process. It doesn't really come up with a solution, or it doesn't really talk about the value of the solution, but it just helps the customer to come up with a decision process by showing them the problems that they have. So it really relies on conversation. It uses referral stories, customer testimonial to create momentum in sales conversation. Basically, it took a customer from it starts from the problem of the customer, discussing with the customer. I mean, probing the customer to talk about the problems that they have, and making them understand the cost of the problems that they have because of the situations that they are in. Then we come up with a solution which usually the salesperson helps the customer to calculate the cost of the problem with the solutions that they have. Then they come up with the value of the solution. So this really creates a deep concern, urgency, and confidence and willingness to pay by the customers. Usually this process is really very successful, and it involves a lot of skill, competency building, skill building and training activities, and embedding activities, and support and coaching activities. But this is the basic what happens actually at customers doorstep. But beside providing the sales competency and this getting this approach at as a sales or promoter level, or as a mason level, there has to be a strong sales support structure, which really relies on performance measurement or performance result based. So the whole approach is to improve the result of the performance of our sales process. So a sales management approach was put in place, which is usually called race approach, which is usually a result is a combination of attitude, competence, and execution. And I mean, to improve result, we need to work on all these three. Otherwise, that we wouldn't be expecting to improve the result. If people do not have the right attitude, even if they have the right competence, they won't be really successful. And also, if people have the right attitude and competence, if they don't know how to plan, if they don't know how to reach the customer, if they don't really know how to execute, or if they don't know how to manage their territory, it will be really difficult for them to improve their result. So for this, we use these levers to improve our sales performance. We really changed our special field staff to be a dedicated sales support. Almost 80% of our field staff was dedicated to the sales support. We also try to determine inputs required to meet this target and work it on this input. For example, we provide a lot of competency based skill-based coaching and mentoring. We also provide a lot of support, a lot of trainings, a lot of backup support. We also establish a strong management information system with week routine, monitoring collection of data analysis and also feedback mechanism. Data were especially on specialized on selected few indicators were collected weekly, analyzed, and feedback was given weekly. We also continuously focus on meeting target, and based on like the data analysis and also overall management information systems that we had, we provide coaching and support for the field staff. So we only not implement the sales process, but we also implement this sales management approach to improve our sales performance. So I mean, DQ sales and this process led us to improve led to 80% of sales, and I mean, introduction of the DQ sales resulted in promotion to sales conversion rate that range between 30% to 70%, which is really quite very high. It is very successful, out of two to from 4 household, 1 to 2 household, tend to buy. And as you can see from the graph on the right side, our sales really increased tremendously within 1 year of introduction of the DQ. It was introduced, I think, in mid-April. The sales was increased by 300%. So this was, one of the best approach that we introduced in sales management and for demand activation. So the key lesson learned on the sales approach is, sales of sanitation is very difficult. Actually, sales is, in any context, sales is really very difficult, and it's like a Pandora box. You don't know what you need to do to improve this. But I mean, that is what we have found out. We understand what we can do to improve our sales performance. So, implementing a well-defined customer-focused approach is really important. That is one of the lessons that we had. And also, when we are working, we try to work on, our partners, businesses. It's really essential to build on existing relationship among supply chain actors. For example, usually retailers and masons have their own relationship. Even if we are not there, they tend to act as a sales for retailers. Masons usually tend to act as sales for retailers. So we build on this relationship to become successful. And we have also found out that commercial based sales management approach is really more effective than the usual health promoters based approach. Sorry. So going to the third key lesson learned, it's related to capacity building. So in relation to capacity building, we implemented two types of main capacity building activity. One is capacity building activities are related to strengthening the governance for WASH. So in this case, we developed and support the market-based sanitation component of the One WASH national program, which is a coordination mechanism for WASH activities in Ethiopia. We also refreshed the market-based sanitation guidelines and other guidelines and manuals. We introduced new training manuals. We usually conducted training and mentoring for administrative and technical government staff. With strengthening the monitoring processes by introducing new approach like joint supervision and consultative meeting. We also introduced a new self-assessment tool, which we call institutional strengthening index. This that helps governance, WASH governance structure to assess their own status and work on it. We also facilitated learning. So this is our main capacity building program that's focused on the governance approach. When it comes to filling the key capacity gaps related to market, we had range of supports that we provide for the market actors. One of the support is, for example, technical skill provision. So in this case, we try to develop standardized training manuals and introduce new construction methods. So I mean, we tend to work on institutionalization of this approach through existing structures. So we have identified that the TVETs are the right structure for this. So we developed a teacher training manual and competency assessment, and partners in institutionalize this with the training with the TVET structure. On the sales management, we have introduced this decision intelligence, sales management approach, but we didn't want that to remain into only in TWASH implementation. So we want it to be scaled, institutionalized into the government structure, because we have found out that to be very successful. So we tried to design and prototype a skill transfer monitoring and feedback structure with existing, government structure, and we also partnered with like structures like Ministry of Labor and Skill, Entrepreneurship Development, which are public PDS providers to cascade and institutionalize sales management. The other one is business development services, operational business development services related to training, coaching, mentoring, and mentoring of businesses on business planning and operation. On this case, also we try to develop guidelines, standards, trainings, and mentoring package in collaboration with EDI and TVETs, and we institutionalized and partnered institutionalized this with EDI and TVETs, which are structures that we find everywhere in Ethiopia. So the other one is strategic business development support. So this support is supports to improve core business performance, like access to loan, market, or need space. So in this case, we really focused on advocacy efforts. So we really had advocacy agendas that are drafted, and we are working on advocating to improve access to finance for businesses, to introduce industry classification and incentives for businesses. This is a continuing effort, and for this case, we really found out that the existing coordination mechanism do not really engage the right kind of sectors that are concerned on this. So we brought these new sectors into the WASH arena. For example, usually the WASH activity was left for Ministry of Health and Ministry of Water, but we also brought Ministry of Labor and Skills on the picture. We are working on bringing Ministry of Trade to the coordination platform. We are also working on to bringing Ministry of Finance, because these are the right sectors to work on. So, to wrap up on, TWASH was instrumental in WASH market growth. The government of Ethiopia has adopted a market-based sanitation as a key strategy in the WASH sector. There is a strengthened government capacity at all administrative level. No, market-based approach is not really, it's not like a unique thing. Everyone has accepted that market-based approach is really the right approach to follow. We have also tried to institutionalize the PDS through existing structure like Ministry of Labor and Skill and Ministry of Health. This structure have got extended reach. They can reach up to grassroots level. And the skill and the training manuals are already embedded in this. We have also established standardized training and competency assessment, accreditation, certifications through existing structure. So these are, quite some of the things that we have done on the learning, on capacity. We have understood that standardization and institutionalization is really critical, especially for scaling and scaling of our capacity building effort, and also expanding, the reach of market-based sanitation, and for the implementation across all areas. We also have found out to be close collaboration with government structures is key to integrate MBS into government strategies. Also, we have found out strengthening the existing coordination mechanism is quite paramount to scale market-based sanitation. These are the three lessons that I have. Thank you for listening to me.
Hi, good afternoon. This is Jerusalem from, I'm a leader of LIXIL SATO in Ethiopia. So I apologize, I'm gonna have to turn off my camera just in case. I don't wanna lose any connection. However, I just wanna introduce myself first through the camera. Thank you, Dagan and Michael. It was a thorough share experience, and I'm very honored to share SATO's journey and reflection on TWASH program here in Ethiopia. For those of you who doesn't know us, SATO is a brand of LIXIL, and SATO's purpose is to empower everyone everywhere to live a life better every day. And we do this by designing affordable and innovative toilets and hand wash solutions. To date, we have shipped our products to 45 countries and impacting 68 million people. I'll try to give my reflection on 3 main points that I feel it is important for this partnership. These are market trials for products, market strengthening, and advocacy. The first point is the market trial for products. This is one of the key aspects of our partnership with TWASH. We had a close collaboration on market trials for our various products. This trial provided us with a critical market insights, such as a willingness to pay, product perceptions, which were very essential and effective for introducing different product lines in Ethiopian market. For example, the data gathered from these trials help us to tailor our product to meet needs of preference for end users and make offering for alignment of the market demand. The second part is market strengthening. I would like to highlight 2 key points on this. The very first one is the market support, the holistic market support. TWASH not only impacted the product testing, but it also highlighted through the processes, it's also highlighted the importance of supporting the market holistically. We learned the significance of masons, so we learned to promote them, investing on the capacity building, and most importantly, making sure the SATO retailers were well connected with masons for a proper product installation. I didn't want to go into detail because the process was explained by Dagam very well. So, but this approach ensured the benefit of the purpose of our product, where it maintained long after they were sold, and also lead a long-term customer satisfaction and market sustainability. The second point into the market strengthening is supply chain. TWASH organized regular supply chain conferences quarterly, and this platform were created for the whole supply chain actors to come together and discuss the challenges and also find a solution there and then. Wherever we can find a solution there and then, we do. Otherwise, we take it and then just work at it to evolve better. So this consistent dialogue was helpful, and it allowed us to continue business operation smoothly even after the program ends. Here, Dagi touched it up a bit, but today, I believe, we can confidently continue work with IGA commercial wing of PSI, and I believe this is a testament of TWASH role as a true business facilitator program. The third point is advocacy. TWASH facilitated quarterly together with Ministry of Health and different ministers, national multi-stakeholder platforms. And this platform strengthened our partnership by showcasing our mutual goal, that the private sector, like LIXIL, plays a significant role in the sanitation sector. This platform leads us ongoing discussion and policy development that opened up enabling environment for WASH sector players within Ethiopia. My conclusion, the experience with TWASH helped scale up SATO's impact and strengthen the sanitation market, and SATO is grateful for the opportunity to be part of such a transformative program in Ethiopia. Thank you, and I'll pass this back to USAID.
Thank you so much, Jiru. Hello, everyone. My name is Jesse Shapiro. I'm a USAID WASH advisor. I work in the Bureau for Global Health at USAID, and I manage our WASH team there. And I also manage on behalf of USAID our WASHPaLS 2 project, which is a global project focused on the sanitation sector, doing a lot of research, partnership, and learning. Back in 2018, the first WASHPaLS project did a global desk review of market-based sanitation. And I want to highlight a couple of the lessons from that, which align with what we saw today to really reinforce them. But first, I want to say how impressive this project is. Back when we did the desk review, we found very few projects around the world that have reached a scale of even reaching 100,000 people, for instance. But this project reached over 1 million people. That's so impressive. And it really shows the power of the market and this approach. And so I think the first lesson here is market-based sanitation is a pathway to scale. And but it really takes time and patience and focus on learning. You saw in the presentation that they started this project in 2017, and it's only now in 2023, 24 that they're starting to realize these massive at-scale gains. It takes a lot of patience to do this work. And that's what we found around the world in other countries as well. We need to be patient and focus on learning and improvements when we do this type of work and other sanitation work. The work here is also strongly aligned with a number of other key concepts that I think we can use to apply this to other regions, other countries, other parts of Ethiopia. The first is they didn't try to create new sanitation businesses. They really worked with the existing businesses in the supply chain. So this is like hardware stores and masons that you heard them mention, and really utilize the innovation in the space that already exists through the Satu line of products. And when working with those businesses, they did have a real focus on viability, making it profitable for those businesses, right? We're not just trying to expand this, and we want them to continue after we're gone. Furthermore, they really focused on tailoring the products to the customer needs and desires. And in this case, which is maybe somewhat unusual context, a lot of people in Ethiopia already have some type of toilet, but it's maybe not an improved hygienic toilet. And so they really focused on upgrades, and that was really successful for them. And that's an example of tailoring it to the local context. But there's a number of other examples in this project and around the world as well. Another key thing that this experience really highlights is that often the active sales of sanitation products is a really missing component of the market. Often in a lot of the markets that we all focus on and we work in, there's a very passive sales model, waiting for customers to come to the hardware store or waiting for customers to come request some services, but that the active sales were a key piece in making this scale. And not just that, the focus of the sales, they introduced their whole DQ sales approach. It's not about doing behavior change, messaging, health promotion. It's more a consumer-focused conversation, working with their existing problems and trying to identify how sanitation can solve some of those. And I think we really need to take that lesson into our other works. Also, interestingly, linked to the viability of the businesses, they also sold complementary products. So they weren't just selling latrines, but they also sold hand washing devices, water filters, other things. That also helps the business be viable in the long term by diversifying their products. Again, this project was not about training masons. It's one of our major lessons learned. We need to look at the entire supply chain. We need to not really forget about the broader business environment. Often as partners, we think we can just do a little activity like training or something to help out, but we do need to have concern for the broader business environment and look to improve that. And that could be things like changing policy and regulations, improving public finance into the sanitation space, creating knowledge and sharing that broadly with the market intelligence, knowledge, attitude, and practices around sanitation. Or in this case, they had some great examples of building capacity in technical and business skills amongst not just the business directly, the enterprises that are selling sanitation, but also the business development services that can provide support to them in the long run, and new businesses that enter the market or just want to sell sanitation products, and the government itself. And I think that's a really powerful lesson about the importance of working with that broader business environment and the institutions in it. While this is like incredibly impressive, I think they also show data that despite the market reaching a lot of people, we're still not always reaching the poorest of the poor. And there's a lot of work to be done there, particularly potentially on subsidies filling some of that gap, but that may not even fill the entire gap. And I just want to highlight that we have 2 studies ongoing right now that are hoping to develop some lessons in this space, both going on in Ethiopia, one which will be available in just the coming months, where we did a willingness to pay study and try to understand better who's willing to pay what for sanitation products, and where the missing part of the population will be. That has some exciting findings that'll be out in the next 2 months. And then we just started also another study looking at layering the market-based sanitation approach with other approaches to try to fill those gaps. In this case, targeted sanitation subsidies and other things. But again, I want to stop there so there's some time for question and answer. Very impressive project, reaching a scale we haven't seen in a lot of other work around the region. And so really want to applaud the TWASH team and USAID Ethiopia and their partners, government of Ethiopia, and all the enterprises. Thank you so much. Back over to you, Ryan.
Thanks, Jesse. I wanted to echo that thanks. I'm just honored to hear directly from the Transform WASH Ethiopia team on these opportunities and questions. Thanks for submitting your questions, everyone. We don't have a ton of time, but I did want to get to a few themes that I saw coming through in a lot of the questions. One question for the PSI team. We got a few questions on different market segments, and so the questions revolving around how do you prioritize urban versus rural versus peri-urban customers, or if there's a different approach you took with segmenting the market, and also were schools or emergency response organizations significant areas of toilet sales and sanitation expansion. And then maybe after the PSI team speaks, maybe Jesse and Drew can add on any thoughts they have, any additional thoughts they have on targeting different market segments across various contexts. So Dagim or Michael, do you want to come off?
Yeah. So I mean, this is the USA Transformation is focused mainly on peri-urban areas and rural areas. So we were not intervening in urban context. So that's why most of the solutions that we had was focused on product and services at household level. Not we didn't have services concerning the other part of the sanitation chain. We didn't have emptying or containment or like transportation or disposal services. So it was really focused on household containment because even in this situation most of the challenges was at household level, and there was no also infrastructure of related to disposal or something like that. So I mean mainly it's rural and urban communities, but the customer segment that we tried to look at was especially related to the paying ability of customers, and we try to classify customers according to their wealth level, and also we try to see to categorize customer according to the sanitation facilities that they have. We will see that like our customer having some kind of toilet, so what kind of products and services, and how we are going to address the need for that. And customers that doesn't have no toilet, or openly defecating, needs a different kind of products and services. So that was the main way of customer segmenting our customers. Concerning the emergency response, I mean most of our activities was like focused on the normal market. It's not really focused on emergency response or schools. It is really focused on household level market in a normal circumstances. We actually works in areas where there is a better, relatively better security situations, because for markets for to thrive, one of the challenges and the risk is security situation, and at times we were able to force our intervention out of some contexts. For example, during the war in the north, where we withdraw directly out of Tigray. When the situation improves, we try to see the possibility of working with the emergency response context, but we didn't have a lot of things to as a takeaway for that. Maybe Miki, if you have got anything to add.
No, I don't have. Please continue.
Yeah, I'll just add, I can't. Oh, sorry, go ahead. Well, I'll just add, I can't speak to Ethiopia specifically, but broader experience with market-based sanitation and extending that to different types of customers, in this case, schools, like an institutional customer. It is possible. I know these products and this style of construction has been tested in healthcare facilities, and it is completely viable, but you do need to understand you're using a totally different customer and totally different delivery model, likely in an institutional space. When it comes to emergencies, I think we need to be very careful and consider how different that market is than a normal, typical rural or urban market. We're talking about people that are migrating or under some sort of trauma or stress, or maybe there's a disaster that's occurred. That really impacts the market dramatically. People are not going to have the same liquidity, availability of funds. They're not going to be all necessarily invest in, maybe they don't own the land or something like that. And so there's a whole set of different conditions. And then I think we also need to be careful, because often in a humanitarian space, those coming in to provide support will look to purchase these in bulk and provide them for free. And that can actually disrupt the normal market quite considerably. And so we need to balance those concerns with solving the immediate problem and sustaining the market long term. Thanks.
Hi. For SATO, for different market segments, we've looked at different institutions, especially schools, very interested in our product, and we've been installing it and see a positive result on that. And also the health facilities, we've approached, and we did a CSR as well directly, and we've seen a lot of interest in the health facilities. So the institution are very vital in this space. And also now I see a lot of interest also in the urban settings in Ethiopia. So it's not, there are a lot of, in the urban area, there is a lot of direct pits and also the S-trap. So we've seen, we have different product portfolio to meet that as well. Over to you. Thank you.
Great. Thanks, everyone. I think we're fresh out of time. Thanks so much for everyone for joining. And once again, thanks to the Transform WASH team. We're really excited to have a webinar, a joint webinar with them and the Action Research Initiative. It's been really a wild ride how this project has worked through a lot of trials and tribulations and gotten some dramatic results, as Jesse pointed out. So thanks to everyone for joining the webinar, and we'll look forward to the next one.